my talk on the progression. Assessment of the visual field progression makes sense to understand what is the vision-related quality of life for that particular patient, and it is also essential to detect the progression to understand what is the speed of the progression which is going on for the patient, and for us to make some changes in our management strategy. So this is how the OCTOPUS hack street, how it gives the software. This can be installed in your desktop, and you can see the right eye, left eye, both eyes. You can see there are multiple graphs you can see. We'll just go through that. So there are various challenges once you are looking at the whether the visual field is progressing or not. The OCTOPUS gives you the global trend analysis, like what the earlier speakers have shown. And you have the cluster trend analysis, you have the polar trend analysis. These three graphs will give you all the details. So these graphical representations are seen as, once it is stable, it shows the straight line, then worsening, then improving. The lines are there. You can easily interpret that. So this is the slope of a trend analysis, provides the rate of change. So this is called as a trend analysis. And we can say that, okay, you have the slope of 1.9 decibels per year. That means we need to treat this patient much more aggressively than those with when they have the lesser trend or the deviations. So the mean defect trend analysis, this is the interpretation guide. You can see the symbols over there, like how much it is worsening. For example, it is 5% probability or 1% probability. You can see that inverted triangle over there. Then you have the red and green colors. And also you have the floor effect, which has been depicted as black in color. So, and if you have, say, for example, you have multiple visual fields then, and you feel that some of the visual fields are not good enough with the high false positives or false negatives or some of the artifacts, the OCTOPUS you can really select from your desktop. You can select and just remove those visual fields for the further analysis and understand how the patient is progressing. So this is the typical behavior of a global trend analysis from early to moderate disease, where you have the mean defect, square root of loss variance, diffuse defects, and the local defects. If this shows like this, then we can understand, because we have to take a separate class in detail, but I'm just going to show here as only very small examples here for the time lag. And if the patient is having a cataract, now just I want you to see here, the diffuse defects are increasingly shown here, and you see the local defect also is increasing. So in OCTOPUS, we can separate the diffuse defect graph separately and the local defect, so we can understand whether the patient has a glaucomatous change happening, or is it something else which is showing that as a defect. And if you have a very localized glaucomatous change, just try to see this global trend analysis. You can see that the square root of loss variance, that means there is an increasing in the inhomogeneity of the visual fields. That's why the SLV is high, and you can see the local progression, and the diffuse loss is almost stable. There is not much of a diffuse loss. So as Dr. Rangaraj was mentioning, the cluster trend analysis, and also we have the corrected cluster trend analysis, shows that the similar way that you have one area of the cluster, that is a RNFL you can see here, and you can just see that where the defect is, if it is closer to the macula, or if it is the central 10 degrees, then you can just make sure that you treat this patient much more aggressively than those without that area is getting affected. So that gives a lot of idea for us whether to treat aggressively or just go as it is. There is no change, fine, we can go as it is. And you can see that in the similar way, you can see the black arrows here that shows that it is a floor effect. You cannot expect anything more to happen. So it just indicates there's nothing more to lose. So once you see that, then you move on to the next strategy. Looking at the polar trend analysis, this shows how much of the loss of the RNFL in that area. And if you have a longer the line, that means more the loss. You have the green color, that means that is improving. Some patients may have that improving signs also. So these are some of the examples you see. This is a stable diffuse pattern, diffuse loss, and you can see that there is improvement in the local defect. And you see this in this, there is an improvement once you've done the cataract surgery that shows an improvement in the diffuse loss And if there is a glaucoma specific increase, then you can see that local defect is showing the increase in the defect. This Dr. Murli has shown in the previous talk how you can represent the progression in the visual fields of Humphreys and in the octopus. So I'm not going to discuss that in much. So very short. Thank you so much for your patient attention.